Hi, welcome to my workshop today. You probably already know why we're here, as you've been invited. However, my workshop is entitled Getting to the Heart of Things, and we're all here to discuss a little bit about the risk factors and then ways we can tackle heart disease. Some of it's have family that we need to support, or some of us are struggling with that ourselves. Did want to start off with a brief chuckle. Panicked by coronavirus, diabetes, heart disease, and colon cancer, not so much. As she's chilling, watching some TV, it looks like, and enjoying some fast food. I did get a brief chuckle out of this just because we've all had coronavirus so much on our thoughts this last year. We do need to remember all those other underlying health issues, though, that we may not be getting looked at this year. I do want to get this started with a brief TED Talk.
I want you to close your eyes for a moment and imagine that you're being rushed to the hospital in an ambulance. You have excruciating chest pain and you can barely speak. When you get to the emergency room, a nurse comes in to see you. "What brings you in today?" she says. You start to tell her, but she interrupts you. "Have you had this happen to you before?" You're trying to collect your thoughts. "What were you doing when it started?" "Nothing unusual, just watching a movie on TV." She hooks you up to a cardiac monitor and draws some blood. And then the doctor comes in to see you. "Hello, how's your pain? Any history of drug use or drug abuse?" Then suddenly it dawns upon you. You're an African American man from Baltimore. You're in your early 20s and you're slender. They've assumed that either you have sickle cell anemia and must be addicted to pain medications, or that you are an IV drug user and you're coming in with a cocaine-related heart problem. This is only one of many scenarios in which racial and ethnic minorities and people from other disenfranchised groups are on the receiving end of poor treatment when they go in for healthcare.
Anyway, I don't know if you guys really felt like you were in the back of that ambulance when she was sharing that story, but I know I did. It's part of the reason I shared it today. Stories like that are part of the reason I got into the topic of healthcare. A lot of people, especially African Americans, are judged before they get treatment. They have an issue of lack of healthcare. They often live in rural environments or have poverty. All of these um, not statistics, all of these topics or reasons are why 1 out of 3 Black men will die from their first heart attack. This means they need these skills that we're going to talk today more than most, but it isn't just Black men. One person dies every 36 seconds in the United States from cardiovascular disease, which can be heart attacks, which is what we usually think of it as. This means that about 655,000 Americans die from heart disease each year. That's 1 in every 4 deaths. I don't know about you, but I think that's way too many. I do want to have everybody break out into groups for just a few minutes of 3 or 4 and just talk. Has anyone in your family or friend circle had heart disease? Maybe they've had a stroke, maybe they've had a heart attack, maybe they've had a couple of other diagnoses like um, ischemia attacks. Um, Talk together and see if you know what heart disease is, the methodology behind it. Um, I'll leave you guys to do that for just a moment. Anyway, now that we're back, I do want to give an opportunity for anybody who would like to share some of the things they talked about in their group. Um, and then I do want to dive into the risks of heart disease, some of the things that we have that we can control, that we could make heart disease less of an issue in our lives. Alcohol would be the first one. Excuse me. If you have more than one drink a day as a woman, or more than 1 to 2 drinks, depending on your size as a man, it can increase your risk of heart disease dramatically. Also, if you have high blood pressure, if you're not sure what high blood pressure is, it is anything above 120 systolic, which is the top number, or anything over 80, which is the bottom number, which is diastolic. If you find you do have those issues when you go into the doctor, talk to him and see if he can help you get treatment. They have medication to lower your blood pressure. High cholesterol is another one, which that one you wouldn't know unless your doctor checks your blood and runs tests for that, but I do recommend everybody get that done. If you have diabetes, especially uncontrolled diabetes, it can increase your risk for heart disease. Also, if you are sedentary or don't exercise much, and then any amount of smoking, whether it is vaping or cigarettes or any other number of things. All of these things are risks that we can control in order to lower our risk of heart disease. Some ideas in order that are simple for you to lower your risk of heart disease are add 30 minutes of vigorous exercise 5 to 6 days a week, avoid more than 1 to 2 alcoholic drinks daily, stop smoking, and make sure you get a healthy diet of lots of fruits, vegetables, whole grains, low-fat dairy products, beans, nuts, seeds, and lean meats. Lean meats means turkey, chicken, salmon, which you wouldn't think so because it does have some fat, especially salmon, which is a fatty fish, but that fat is a good fat, which is kind of an oxymoron, but I just wanted to let you know some of those good meats that you can eat. Make sure you start with small changes. Don't get overwhelmed all at once. Small possible changes you could make are to add more fruits and vegetables to your diet. The goal is to work up to getting half your plate in fruits and vegetables, which is a lot, but you can make it fun. You can do a stir fry. You can add fruit to a cereal bowl and that kind of stuff. And also find a fun form of exercise that you enjoy, something you look forward to, whether it's dancing or basketball with the boys or a walk with a good friend. All of those are great ways to get your heart rate up. Also, work on swapping out soda for water. You can also drink 100% fruit juice and low-fat milk as well. Another meme that I thought was funny while I was putting this workshop together was fatty foods are unhealthy and may cause heart disease. Make sure you eat a diet of high in carbohydrates and sugars. We all need to work hard when we change our habits, that we don't swap out one bad food for another, that we're really going for the good changes. Just remember when you're trying to make these changes, whether you're doing it by yourself or as a family or friends, take it one day at a time. Don't throw in the towel because of one day of bad choices. Remember, this isn't a quick fix, but a new lifestyle. One bad day will not ruin all the good choices you are making. And as I close today, I wanted to thank everyone for coming. I did want to leave you thinking about one change that we talked about today that you can do to lower your risk of heart disease. If you change even one thing, it can lower your risk by as much as 45%. Isn't that worth it? Isn't it worth it for us to be around more for our family and friends and loved ones? Thank you so much for participating with me today. I did want to let you know that I will be having feedback sent out, and it will be in the back of the room for you to pick up and fill out. And I would appreciate any feedback you have for me. Thank you, and I hope you've learned a lot today. I know I have.